Good morning. Hi, this is David George with Sleep and Sinus Centers, and I thought we'd talk a bit today about the um, the concept of sleep apnea as it relates to weight. And there is a general conception that sleep apnea, and especially obstructive sleep apnea, is related to people just being overweight. And there is an element of it that is related to a component of it is related to weight gain. And I'd like to explain a little bit about how that plays together. It turns out that there have been some studies where people have done weight loss surgery, and the weight loss surgery itself doesn't even have to have significant weight loss before people's sleep apnea starts to get better. So it may not be exactly the weight that improves the sleep apnea. Now, it is a problem with excess weight that you get what is known as a obesity hypoventilation syndrome. And what happens with that is that the lungs and the diaphragm and the rib cage does not expand as well in people who are obese because it just has extra weight on the rib cage. It also is like that when people have significant deformities like scoliosis that's really bad. Because the ribs cannot expand sufficiently, and so the lungs don't fully inflate, and that sets you up for having decreased amounts of air in the lungs, and subsequently decreased amounts of air in the blood, and so you're more easily into a zone where you don't have enough oxygen. It's kind of like having a low bank account and irresponsible teenager with a checkbook. It's not that you can't overdraft any amount of money in a checking account, but you're much more likely to overdraft it if you have the combination of a low starting balance and a irresponsible teenager, which I have seen firsthand. So in terms of weight loss, you're never going to get anybody that is going to tell you not to lose weight if you are over your ideal body weight or you're not lean. Recognizing that the BMI, body mass index, is not built for all body types. So some people may be a lot more muscular and have a lot more lean muscle mass, and so the equation is not exactly the same. And it's almost always a good idea to do that because it affects so many things, but it doesn't always directly affect sleep apnea. I have certainly seen a lot of people who were heavy that I thought should have had sleep apnea, and the sleep study did not show that. Now, the sleep study is a technique where we hook you up to oxygen, check your brain waves, check the oxygen in your blood, hook you up to a sensor that detects how much breathing is going on, and then determine how much effort you're making. And we can tell that you should be breathing here and you're not breathing, or you're trying to breathe and something is closing off your airway so we're not getting enough airflow. That process allows you to look at this and say, hey, this guy should be breathing. There's something wrong here. And then you can analyze the anatomy to see what's happening. But it turns out that sleep apnea may be a problem for those people who have not been able to lose weight, because it sets off a hormone cascade due to the stress of not having enough oxygen. So if you are having trouble losing weight, and or you've got blood pressure problems or diabetes, or you're having other issues with your health, cardiovascular problems, heart attack, stroke, or something along those lines, you should really look into sleep apnea, especially if you have an arrhythmia of the heart, and you told you lose weight, etc. It's going to help. You need to look at those kind of things, because all of these things can be related directly to the episodes of lack of oxygen. And the lack of oxygen during those spells where you stop breathing, either your tongue is falling into the airway or something else, the lack of oxygen triggers an emergency response in the brain. And there's really nothing more stressful than smothering to death. Just remember, it's not snoring, it's smothering. And that stressful response raises the blood glucose that is available, because you want to be able to run if you're in some sort of an emergency situation. And so when you're smothering, the body responds in that same sort of way. That is done by growth hormone releasing, which causes growth hormone to release, and it also causes you to eat. Cortisol, which also causes you to eat, and kind of causes that sort of rounded center body habitus, and that's something that we've known when you have steroids. That's your body's inherent steroid, and there's a chemical that's released that causes cortisol to go up. And then you have a couple other responses that do that. Of course, you have that sympathomimetic activity. There's the sympathetic nervous system that is kicking in and causing some problems as well, also raising the glucose. And those things on a chronic basis can make us eat and gain weight, and it may actually be hormones. So if you're having trouble losing weight and you have sleep apnea, and you're told that you have to lose the weight and your sleep apnea will just go away, that's probably not an accurate descriptor. I think people understand the difference, but getting that point across to people is sometimes a little bit of a difficult equation. And then secondly, if you're having trouble losing weight, you may have sleep apnea, and fixing that may give you enough of a change in your hormone status to actually help you lose weight. Obviously, we know that thyroid problems can do that. These other aspects also tend to cause you to improve that situation. So, hope this is helpful, and we'll see you soon.